You're listening to the Agent Survival Guide Podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static. In today's episode, what do you do when your client wants to switch their Med Supp plan? Depending on the state they live in, it might be an easier task than you think. The Insurance Agent's Quick Guide to Medicare Supplement Birthday Rule states, written by Ashley Toomey. Switching Medicare supplements, also referred to as Medigap plans, can be tough. This is especially true if your client has to answer the required health questions during their switchover process. Answering these questions can open the door to higher premiums or denied coverage. Fortunately, some states offer Medicare supplement enrollees a birthday present every year, the chance for them to change their Med Supp coverage on or around their birthday. Keep listening to get the scoop on the Med Supp birthday rules. Purchasing a Medicare supplement is first available when your client turns 65 and has Medicare Part B. This opens a one-time 6-month Medicare Supplement Open Enrollment Period, or OEP for short. Throughout this time, insurers cannot deny your client coverage or charge them higher rates based on health issues. After the OEP closes, joining a Medicare supplement or switching policies generally requires beneficiaries to go through medical underwriting. Insurers can charge your clients more or reject them based on health conditions if your client does not have a guaranteed issue right. To combat this hurdle, certain states have implemented Medigap birthday rules. Think of it as a sort of special enrollment period, or SEP for Medicare supplements, except for the part where it's not one. Let me explain. In Med Supp birthday rule states, policyholders have a window of time around their birthday each year when they can switch to a Medicare supplement with slight differences in benefits or the same benefits, depending on the state. Since each state has its own rules, it's vital that you are able to explain your client's state rules to them. Some states even turn the window of time into a year-round possibility with guaranteed issue rights for plan switches. Every state is a little bit different than others when it comes to their birthday rules. It's also crucial we note that less than half of all the states in the U.S. participate in the birthday rule or something similar. With all of that being said, let's get into our list of states. We'll start out with California, which adopted a birthday rule in 1997 and then updated it in 2020. It was a 30-day window from 1997 through 2019. And then in 2020, Cali upgraded to a time frame of 60 days after a Med Supp beneficiary's birthday. Switching can occur between any Med Supp carrier to a plan that offers equal or lesser benefits. In Delaware, beginning with coverage year 2026, Med Supp beneficiaries have a window of 30 days before and 30 days after their birthday to make a switch. Switching can happen between any Med Supp carrier to a plan with similar or lesser benefits. Idaho established their birthday rule in 2022 with a period that lasts 63 days after a Med Supp beneficiary's birthday. They can move between Med Supp plans of equal or lesser benefits from any carrier. Illinois began offering a birthday rule in 2022 that's limited to Med Supp beneficiaries between the ages of 65 and 76. Beneficiaries have 45 days after their birthday to switch to a Med Supp plan of equal or lesser benefits. And new for 2026, the plan must be with the same insurer or affiliate as their previous plan. Another new state for the 2026 coverage year, Med Supp beneficiaries in Indiana have up to 60 days to switch to a Med Supp plan from any carrier if it is the same plan letter as the one they're switching from. Kentucky implemented a similar birthday rule to Indiana in 2025. Med Supp beneficiaries have a 60-day window to switch to a Med Supp plan from any carrier if it is the same plan letter as the one they're switching from. Louisiana created their birthday rule in 2022 and updated it in 2023 to restrict movement between plans of equal or lesser benefits from the same insurer or affiliate. Med Supp beneficiaries in Louisiana have 63 days after their birthday to make a switch. In the state of Maryland, they adopted their rule for coverage year 2023 and give Med Supp beneficiaries 30 days after their birthday to switch to a Med Supp plan from any carrier with equal or lesser benefits. Nevada's birthday rule was implemented in 2022 and starts on the first of a Med Supp beneficiary's birthday month and then runs for 61 days. Medigap beneficiaries can switch between Med Supp plans of equal or lesser benefits from any carrier in Nevada. Over in Oklahoma, they've had a Med Supp birthday rule since 2023 that runs for 60 days after a beneficiary's birthday. Med Supp beneficiaries can swap out their Med Supp plan for one of equal or lesser benefits from any carrier during that time frame. Oregon implemented their birthday rule in 2018 with a limited time frame of 30 days. In 2020, like California, the time frame expanded to 60 days, 30 days before and 30 days after the Med Supp beneficiary's birthday. Switches can be made between Med Supp plans with equal or lesser benefits from any carrier. Utah put their birthday rule in place for the 2025 coverage year, allowing Med Supp beneficiaries 60 days after their birthday to switch to a Medigap plan with similar or lesser benefits. But in Utah, the plan must be offered by the same insurer. In Virginia, also implemented in 2025, Medigap beneficiaries have 60 days after their birthday to switch their Med Supp plan for another plan with the same plan letter from any carrier. And then in Wyoming, beginning in 2025, Med Supp beneficiaries have a 63-day time frame after their birthday to switch plans. They can move between Med Supp plans from any carrier, but they must stick with the same plan letter. In addition to these 14 states we just mentioned, we've got a couple more states with stipulations worth mentioning. First up, Connecticut, Maine, New York, and Washington State do not have state-specific birthday rules, but they do allow year-round switching. No medical underwriting is required, and switching at any time in those 4 states is considered a guaranteed issue right. In Missouri, they don't have a birthday rule. They have what we call an anniversary rule. Med Supp beneficiaries have a 60-day window that runs 30 days before and 30 days after the applicant's policy anniversary date. No medical underwriting is required, and Medigap beneficiaries must choose a Med Supp plan with equal or lesser coverage. Massachusetts offers a 2-month window for Med Supp beneficiaries to make changes without medical underwriting. That time frame begins on February 1st and runs through March 31st. And then finally, Rhode Island made some changes in 2025 that allowed beneficiaries to switch to a Med Supp plan during AEP without underwriting. They also allow Medigap beneficiaries a 30-day window, beginning on their birthday, to switch Med Supp plans without medical underwriting. Many of these states have either newly updated or created their legislation around birthday rules in the last couple of years. With all these recent changes, you can see a trend that other states may also begin to implement or update their own birthday rules. Now that we've gone through the state specifics, let's go over some frequently asked questions. We'll start with, when should a client use their state's Medigap birthday rule? Make sure that your client has a current Med Supp plan and resides in one of the states with a birthday rule. If your client is unhappy with their current coverage, they can use the birthday rule to switch carriers or plans depending on the state. A client could use the rule to switch to a lower cost plan, change insurance carriers if they no longer like their current one, find another plan with better member care and services, or change coverage due to changes in their health. Coverage changes must be made during the timeframe specified in the state's birthday rule. Most times, this is during their birthday month. Sometimes it can start before their birthday and end a month after their birthday. And another important note to consider, in some states, your clients can apply for the new policy at any time during their respective windows, but the coverage may not go into effect until after their birthday. Be sure to check your client's state-specific rules for further details. Next question, why should your clients use the birthday rule? Some of your clients may not even know how beneficial a Medigap birthday rule coverage switch could be. Using this rule could help them get lower premiums, coverage changes without medical underwriting, and a better insurance company for better service despite similar prices and benefits. And going hand in hand with that question, what are the Medicare supplement birthday rule limitations my clients should know? As with all rules, the birthday rule has its limitations. Some of these include that the birthday rule is not available in all states. Make sure your client knows whether this is even an option for them. They usually can't switch to a plan with more benefits unless they qualify for guaranteed issue or can pass underwriting. If your client misses the deadline to apply, they will likely have to go through medical underwriting to switch plans. And the plans your client is interested in may not be available, even with the birthday window of time. Let's expand on that last one because it's another frequently asked question we've gotten. Do all insurers have to honor a state's birthday rule? As you've heard, most insurance birthday rules differ from state to state. There may be some states where your client can switch to any carrier with differences in the benefits of the plan. There may also be some states where they can only switch to certain carriers or affiliates. If all eligibility criteria are met and the change holds up against the state's law, then yes, the insurer should honor it. Can clients use Medigap birthday rules to switch to a Medicare Advantage plan? No, the switching is only available for Med Supp to Med Supp coverage. Your client would have to wait for the annual enrollment period, the Medicare Advantage open enrollment period, or another SEP if they wanted to go from a Med Supp to a Medicare Advantage plan. They could also utilize their Medicare Advantage trial right if they have one. Do payments applied to the original plan's deductible carry over to the new plan's deductible? No. When your client switches to a new policy, they receive a new deductible amount. A new policy is considered a new contract, even if it's with the same insurance company. This is especially important information for clients in high deductible plans, like High Deductible Plan G. Once your client switches plans, the new plan's coverage, including the annual deductible, usually becomes effective in the first month after they apply for coverage. You should help your clients weigh the cost savings of the new policy against the cost of paying their deductible all over again if they're on a high deductible plan and they have made significant payments toward their deductible for the year. Either option may end up working better for one client over the other. Sitting down with them to discuss these options can help ease their anxiety over the switching and cost. There is one very specific exception in this case, and that is something called the Medicare Part B deductible exception. If your client switches from a Med Supp Plan F to a Plan G, their new Plan G will not make them pay the Medicare Part B deductible again. This is only applicable if their previous Plan F already covered it for the year. The exception only works because the Part B deductible is handled by Medicare itself. And last but not least on our list of questions, how can I help a client use the Med Supp birthday rule? Because there are so many rules that differ between select states, your clients may be a bit confused on how their specific state's birthday rule applies to their situation. Couple of things you can do to help. Educate them about the birthday rules in their respective state. Compare different Med Supp plans with them to review their options. Advise them about any coverage gaps they may experience during the switch, and help them complete their application for their new desired coverage. And don't forget that Ritter Insurance Marketing, the FMO that powers this podcast, can help you out as well. If you're not already, register with us and get access to tools and resources that can help bump up your business to the next level. Now, just to recap, the birthday rules we talked about today are not federal. They do vary quite a bit at the state level, and there are many parts to consider if your clients are looking. And there are many parts to consider if your clients are looking to switch their Med Supp coverage. But with the knowledge you learned in this episode, we're confident that you can help your clients navigate the complexities of the Medicare world. And when you need help navigating the industry, we hope you turn to the Agent Survival Guide podcast. Thanks so much for listening. We will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written by Ashley Toomey, script proofing by Emily Ryan, recording and production by me, Sarah Ruppel. Podcast design and artwork by Urban Rivera. Like what you hear? Follow along with our show wherever you get your podcasts.